Many parents come to me saying that their children have flat feet. Let us see about flat feet in today's video. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, health related explanations are provided via videos which are released every week. If you want to see such videos, kindly subscribe to this channel. Also press the bell icon adjacent to it, get instant notifications whenever new content is released. Now many people post in the comment section about things which they want to make videos on, but those videos have already been made. They don't get notifications whenever I release videos because you don't subscribe and press the bell icon. It's not enough just to subscribe, but also press the bell icon and click all notifications so that you get notified whenever I release any new video. This week's video is about flat feet. This is also called as pes planus or fallen arches. Okay, basically feet are the foundation for body, especially when standing. Okay, so feet has a complex mechanism to maintain this foundation. It has around 26 bones, 33 joints, more than 100 muscles, tendons, ligaments. Now all these together form the structure for this foundation to hold your body erect. The entire body stands on your feet, and for this God bar nature has designed a structure called arches of feet. In the mid foot, in the inner side of mid foot, there is an arch. Okay, these arches are essential for holding your body in a certain way. When these arches are lacking, when there is no arch, you call it as flat feet. This can happen either in children or in adults. In children, all children tend to have flat feet by birth. These arches do develop by 2 to 3 years of age. Even until 5 years you can wait, but they usually develop by 2 to 3 years of age. Lack of or slow progression of development of these arches is the reason for flat feet in children, is often the reason. But in adults, already formed arches get deformed. They fall. These fallen arches are the reason for flat feet in adults. Similarly, you can have two types of flat feet, either a flexible flat feet or a rigid flat feet. Flexible meaning in some positions you can see the arch, but when you stand, this arch gets disappeared. When you are hanging your feet, you can see the arch. When they are walking tiptoe, you can see the arch. But when they place their feet on the floor, the arch gets disappeared. This is flexible flat feet. Usually in developing children this happens. In rigid flat feet, especially after injuries to the foot and then your arch has fallen, then this becomes a rigid flat feet. What are the risk factors or what are the causes for flat feet? As I said already, in children it is often genetic or slow development, or sometimes your Achilles tendon may be shortened or may be tightened. This is the reason for having flat feet. When I said about delay in development, usually arches tend to develop by 2 to 3 years of age. You can still wait at 5 years of age. Even at 10 years, if a child has flat feet, there is still chance for the flat feet to become better as the child grows older. But in adults, once there is falling of arch, there is no chance for the flat feet to get corrected on its own. So that's the crux. What is the reason for flat feet in adults? As I said already, you can have injuries and subsequent healing may deform these arches, or uncontrolled obesity, diabetes mellitus, pregnancy, other joint and bone conditions can all contribute to the formation of flat feet. Okay, I have a flat feet. What is the problem with this? Not necessarily just mere presence of having flat feet is going to result in any serious problem. Especially in children, if this is not going to raise any symptom, it is never an issue. But what can arise because of flat feet? Because feet are the foundation and an arch is essential for strong structural integrity. Because you lack arches, sometimes you may get pain. Especially if you have prolonged walking or prolonged standing with flat feet, you can develop pain. This pain can happen in the arches of foot, in the ankle joint, in the calf muscles, in the knee joint, in the hip joint, in the lower back. So anywhere you can develop pain because of flat feet. Especially if you indulge in high impact activities like basketball or soccer, then this can give rise to more pain. Now apart from pain, the associated condition which led to the flat feet, a bone or joint condition, may give rise to other symptoms, but essentially pain is only the predominant symptom, and this pain is also not universal. More than 90% of individuals with flat feet may not have any symptoms at all. Okay, how do you diagnose flat feet? At home, simply, you can wet your feet and place these feet on a flat floor. You can see the impression it created, the wetness it created. Usually you will have impressions of your toes, you will have impressions of the forefoot, you will have impressions of the heel, you will have a narrow or arched impression of the midfoot. That's the normal impression as shown in the figure above. If you have the impression of entire feet, of your wet feet, that means you have flat feet. You can simply diagnose at home. For a doctor, before advising definitive treatment, this may require a CT 3D reconstruction or X-rays, but at our household level, this just wet impression is enough. Okay, do you need to visit the doctor necessarily for flat feet? Especially for children and as an adult, if you don't have any symptoms, it is not necessary to get treated or to visit a doctor. But you have associated problems or if you have severe pain, then you need to visit the doctor. How this can be treated? This can be approached in two ways. For children, for adults. For children, as they are developing, they can be given orthotic devices, they can be given foot exercises, they can be given foot support exercises, physiotherapy, all these can help. But in children, all this is required only if they have symptoms. For adults, similarly, you can have orthotic devices or special fitting shoes. So they can help. Avoidance of these high impact exercises can help. Medications are given usually to relieve pain. Ultimately, surgery may be required in a small percentage of individuals, especially if it is following injuries, unhealing or bone or joint diseases. They may require surgery to have permanent relief from pain and complications due to flat foot. If your flat foot is due to overweight and obesity, probably weight reduction may be of help. In essence, if you think about flat feet, not every individual, whether a child or an adult, needs to get treated merely for the presence of flat feet. If you don't have symptoms, there is no treatment required. If you have symptoms, you can just modify your lifestyle according to that, you can get through. Only if you have severe symptoms or if you have a alteration in the anatomy because of the disease, you will require definitive management in the form of surgery. Hopefully, this video would have cleared your confusions regarding flat feet. If you like this video, kindly share it among your friends and relatives. If you want to see such videos, subscribe to this channel. Till we meet again, bye.